Good afternoon, sir. My name is Baby Jane Muscato. So today I will be assessing for the
posterior tibial
cardiovascular system. So before we start, I'm going to identify my patient, asking for her name and date of birth. So ma'am, what is your name and your date of birth? After identifying a patient, I will explain to my patient what is the purpose of this examination. So ma'am, the purpose of this examination is to
So
check
patient
how
has
your heart and blood
pulses,
vessels are
then
working.
after that,
After
we
that
will
is
be
I will perform hand hygiene to avoid
assess the
any
patient in a
contamination.
comfortable position, then perform hand hygiene and document the findings of the assessment.
Next is I will assess my patient in a comfortable position. So first thing in assessing the cardiovascular system is I will inspect and palpate for the carotid artery of my patient, one at a time. So next is I will use the bell of the stethoscope and auscultating the carotid artery of my patient. So my patient carotid artery pulsation is normal. Next is I will inspect for my patient's jugular veins distinction and pulsation. Next is I will inspect for my patient's cordon for contour and hips.
Pero kayo wala. Duha na lang? Nang wala?
Next is using the palmar surface of the hand with 4 fingers held. Is I will locate for my patient's suprasternal notch. Down 1 to 2 inches is locate for the angular buoy.
Ang bala ba?
Angular buoy.
Dumi dito, dito Luis. Dumi. Dito Luis. Pero yun.
So moving laterally to the right is locate for the aortic area.
Okay na.
Move laterally to the left is locate for the pulmonary area.
From BSN 1A12
Down to the first point is locate for the tricuspid area.
I will be assessing for
Intercostal
the
space is
cardiovascular.
locate for the mitral area of the
So
patient.
first thing we're gonna do is to identify the patient. So Miss, can I know your name?
Before mag-meet ka, asa mo ka?
Tricuspid.
Asa na? Asa mo na? Sa location?
Thank you for that, Miss. So after that is we're going to explain the procedure
Kung saan
to
na
the patient.
intercostal?
So
In the second and third
to
class.
the patient while we're doing the procedure. So Miss, the procedure, the assessment we're doing today is to
Ang herbs ay sa
determine
siya na
any
intercostal
early
space.
diseases
Oh.
from the
Ang tricuspid.
your cardiovascular system, and also to to examine if your heart
Asa mo ang tricuspid yun?
strong and healthy. So after that, I will now perform hand hygiene.
Kana. Where's your mitral?
Next is
After that,
your
I will
systematic
be assessing the
auscultation
patient
using the
specified position about
diaphragm
30
of
to 45
the
degrees.
stethoscope.
So I'll be proceeding now to assessing for the cardiovascular system.
I will
First,
ask
we're
the
going to
patient to breathe
inspect and
normally.
palpate the carotid arteries one at a time, and also using the bell of the stethoscope is we're going to auscultate the carotid arteries one at a time. So using my index and middle finger.
I will use the valve of the stethoscope for the low sound. Asking my patient to breathe normally.
So,
Sure ka? Bell, dito yung gamit na.
after
After
palpating
sa
and
use the valve.
inspecting for the carotid arteries, the position of my patient is grade 2, which is wrist, and that is normal. Now I will be auscultating the carotid arteries one at a time using the bill of the stethoscope.
Sure ka, ano, na-post mo na?
Yes, sir.
To ko ni mo. Acting. Sure ka? Na? Wala. Saka pa. Saka pa lagi.
Ano, sir?
Jud. Acting.
Yes, sir.
Okay.
Next is I will inspect for my patient's upper extremities for collar, lesions, and masses.
So upon auscultating my patient, the pulse of my patient is
Wala
grade 2,
pasyente Jud.
which is brisk, and that is normal. So now I will be inspecting
Next is
for
I will
the neck for the
palpate for the radial and regular
jugular
artery
vein
of my patient.
distension and observe the pulses. So, can you please?
Oh, baby. Baby mo din mga galan. Pagkitapos sa baby.
So after inspecting the neck for the jugular vein
Neck also
distension,
vein?
there is no venous pressure, there is no vein elevated. So
May
that
puso wala, baby.
so after that I will now proceeding to palpate the precordium, inspect and palpate the precordium for the contour, position, and hips. So, Miss,
Na? Buhay pa na.
so upon palpating for the precordium for the contour, and there is no position palpating, so that is normal. So now I'll be doing using my palmar surface. I will now be palpating the precordium and from the aortic and also the aortic from the aortic
Pagkaroon kami bigay
area
ko, ang puso
down to the
wala.
mitral area.
Ating.
No, sir, from inay lang.
From the sopra
Next is I will inspect for my patient's lower
Sternal,
extremities for collar,
notch.
lesion, and masses.
I will be down to
Check ang kuko.
1 to 2
Patay
inches
ba or buhay?
to feel the depression of the ankle oblique, and then move to the lateral side from
Ano
to
mo,
the left,
ang
which
one.
is the second
Walk
intercostal
arty. What you-
space for the left sternal border to feel the aortic area. And then move to the second intercostal space left border to feel the pulmonic area. And then fifth intercostal space mid-sternal
Tama.
area to feel the tricuspid
Karte mo gunit ko
area.
ni.
Patients in his
Mag-nurse ka di. Oh, wala naman ka.
So
Next.
I will be proceeding
lagi
to
ka,
the
baby.
fifth intercostal
I will
space
check palpate for my patient's breathing edema.
mid-clavicular sternal border to feel the mitral area.
Regular area.
So after that, I will now use a systemic auscultation from the aortic area down to the mitral area. Using the diaphragm to hear the low pitch, high pitch. Sorry.